doing today? Okay. Yeah, of course. Well, it's a good thing that you came in. Can you just explain to me what the issue is? I'll take it down and we can address each problem. Okay. Okay. So you have an itchiness in the throat and okay, stuffy nose. Good. Anything else? Any other symptoms? Okay. I see. So, oh, okay. So also an itchiness in the ears, both sides. Okay, so I'll take a good look at that. Good. Okay. And when's the last time that we had a meeting? Quite a while ago. Okay. In that case, I'm going to do an overall checkup at first. Yes, want to make sure you're okay. And then I'll take a look at what's going on with your throat, your ears, and your nose. Okay? Good. So, I'm going to put on some gloves just after disinfecting my hands. Yes. Would you like some? No? Perfect. Good. Yes, it smells quite strong. Now I'm going to put on these gloves. These are not latex. They're actually vinyl gloves in case anyone is allergic. So let me just carefully put these on. You'll see they're quite comfortable and soft to the touch, and even nicer texture than latex, I believe. So, now that I have these on, if I have your permission, I would come close and examine your face. I will be touching your face as well throughout my checkup. Okay? Good. Now, the first thing I want to do, like I said, we're going to verify your general health since it has been a while. So, the first thing that I'd like to do is just listen to your heartbeat, okay? So I will come in close, put this against your chest, and I'm going to ask you to take deep breaths, okay? Alright. So breathe in. 1, 2, 3. And breathe out. Good. Again, please down here. Breathe in. Deep breath, yes. And breathe out. Good, 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 good. Around on this side. Breathe in for me up here. Yeah. to come around the back and do the same thing, just twice. Okay? So breathe in. Excellent. Breathe out. Good. And over here, breathe in. Great. Breathe out. Good, good, good. Well, I'm happy to say your breathing seems quite relaxed. Yes. Good results. The next thing that I'm going to take a look at is your blood pressure. I know you hate this part, but it's important. So, I'm going to put this strap around your arm and we'll take it off, okay? Once we're done, it won't take long. If at any point you feel discomfort and it's getting too tight, let me know and we'll stop. Just slide your arm through here. Good. And I'll start up the machine. That's okay so far? Good. Alright. And okay. Nothing too worrisome. Everything seems normal. And yes, it's loosening up. Okay. Let me just take this off. Okay. Great work. So that was 1, 2. Okay. Now, next step is pretty important. Since you seem to be having some troubles with your throat, I'm going to check your temperature. I want to make sure that this isn't some sort of virus that your body's trying to fight off. We might then test if maybe it's an allergy, so on. Yeah, okay. Okay. Can you just yes, open your mouth wide. Yes, and lift the tongue up. Good, and I'll just leave that in here. And good. Let me just check. Okay. What is it looking like? Good, good. Okay. We're good. So, now your temperature does have me a tad bit concerned, okay? You are currently at 38 degrees, 38.3 to be exact, Celsius. This could be an indication of a fever. However, it is slight fever and could easily be remedied. Okay? So, don't be too worried. But I would, at this point, like to take a look at your throat. And I'm going to be feeling for these 2 lumps here. Those are your tonsils. And just checking if they're swollen right now, which could be a sign of fighting off any kind of sickness, okay? So just tilt your head back a little bit. Okay, good, good. On this side, seems a little bit swollen. How about here? Okay, same thing, just a little swollen. Okay, so I do think you might have some kind of bacterial or viral infection. I'm going to take a look now in your mouth. So, last time we opened wide, you lifted the tongue. This time I'm going to ask you to stick it out, okay? Thank you. So just stick out the tongue. Yes. Great, you're doing great. So let me see what I see there. Okay, yes, I definitely have. It looks like a little bit of mucus. Yeah, okay. A bit of swelling. Looks a little bit worn and yeah. Yes, okay. There is definitely a lot of redness in the back of your throat, inflammation, tad bit of a buildup of mucus I can see, which definitely tells me that there is a little bit of a fight going on in your system, but you're holding off very well all of these bad bacteria. Okay, I'm going to take a even deeper look, okay, into the mouth, this time with a light. So, okay. Again, I'm going to ask you to open wide, stick out your tongue, and I'm just going to, there we go. We're going to look and, okay. And on this side in the depths. Okay, good. I was just confirming what I had seen. So yes, just a little bit of swelling. Some of your lumps are a bit more pronounced than usual. But don't be too worried. I'm gonna look at your ears to confirm. Yes. Okay. So, let's see. I have my otoscope here, and I'm going to be looking from ear to ear, okay? I know that you said that your ears were quite sensitive today, a bit itchy on the inside. So I'm going to start on this side first, and I just need to look real close. So I'm going to gently cover over here and look. Okay, so there we go. Okay, does this feel okay? Warn me if it feels a little too uncomfortable for you. No? Okay, good. So just going around. But so far I'm looking your ears are irritated? Are you scratching a lot? Rubbing it, okay. Well, that explains all of the redness. I'm gonna look at the other ear to see if we have the same issue, okay? Okay, now on this side. There we go. So once again, any pain, and you just tell me to stop, okay? Alright, so as suspected, similar redness, similar swelling. Seems to be a little bit of a kinlight. And does it scratch too much? Okay. So look, just roll through the just yes, okay. Good. Okay. So, what I can say is that your ears are definitely experiencing yes, some irritation. You are causing a mild rash towards the outer part of your ear by constantly applying friction and just rubbing constantly, right? So I am going to put a topical lotion, and after that I'm going to add a few drops. So just need a small Q-tip from in here. And just a dab of topical cream to come kind of calm this rash that's spreading. So just here, gently around, and here as well. Okay, very smooth. Yep. That should have a very soothing effect, and it'll help reduce the rash, okay? Now I'm going to add the drops. Okay. As you can see, this is quite a thick liquid. The consistency, yes, very thick and viscous. So I need you to just tilt your head one way, okay? So just gently. That's okay, no more than that. There we go. A little bit more. Good. You can come back. Thank you. And now the other side. So there we go. And another one. There we go, we're done. Good. So it will take a little bit of time for that to start working, but it's currently just getting through, and soon your ears will be all better No longer itchy. Yeah, you might even be able to hear a little bit more clearly than you have been for the past couple of days. Good. Okay. So now that I've checked your ear and your throat, anything for the nose? Just a stuffy nose. Okay, let me just look. Okay. Down here. Just a little bit stuffy, but I think it's all connected to your throat, right? So that would explain why you just have a bit of a runny nose. Now, based on what we've seen today, it seems like you really got a flu. So I'm going to leave you with some prescriptions to take. I will be giving you a nasal spray. Yes, they are medicated. It is meant to help relieve those kind of that kind of itchy, I'm about to sneeze feeling. Aside from that, what else? Yes, so for your throat, I would suggest for the time being to take a few simple medications. I'm gonna give you, yes, Tylenol. That's it, yeah. Tylenol. Of course, I know you're a busy person, so night and day so that you can sleep better. In regards to your ears, though, that is our biggest issue in this case, because it has begun to cause a bit of an irritation, and you don't want to develop any scar tissue. Also, there is a bit of a buildup of wax, so I will prescribe. Let's see. Just let me look. Okay. So the current drops are already working. They're taking effect pretty quickly, which reassures me that this can be taken care of quite quickly. So I'm going to do, yes, so for 5 days, twice a day, so each ear you're going to do 2 drops in each ear. Yeah. Try not to go over that dosage. You don't want to do any permanent damage to your eardrum. But 5 times a day, twice a day for 5 days. And these, yes. So these are the drops. Let's see. For your ears, throat, if you'd like, you can go just get a over-the-counter cough syrup as well. Some Halls or any type of lozenge would do great for the soreness of your throat. But aside from that, with the nasal drip and the eardrops, you should really feel loads better in a couple of days. Like I said, just a flu, but nothing to really be too concerned about. Your vitals looked fine, so I think we've pretty much gone over everything. I will fax this over to your pharmacist. Same one on exactly. Okay, good. That's what we have in our files here. So I will fax this over, and just make sure to drink tons of water. Okay? Tons of water, maybe some tea with a bit of lemon. Drizzle, just a slight drizzle of honey. And a couple drops of spice, Tabasco or anything. big kick and a cup of tea. Good. So you do that, you get yourself some sleep, and you will be back in great shape in no time. Good. Okay. Well, that's it on my end. Let me just remove the gloves. Kobe. And I'll see you soon, but not too soon, I hope. Just in time for your next checkup. Okay. Have a lovely day. Great evening.